Hey everyone, today we're diving deep into a topic that's close to my heart, your health. We all know that feeling when the doctor prescribes a medication, we take it hoping for a swift recovery. But what if I told you that some common, everyday medications could be silently impacting one of your most vital organs? Your kidneys. That's right, we're talking about those powerful filters that work tirelessly to remove toxins from your body. In this video, we'll be uncovering 5 types of medications that might pose a risk to your kidneys if not used carefully. We'll break down the science in a way that's easy to understand and, most importantly, empower you to have informed conversations with your doctor. Remember, this video is for informational purposes only and not intended to replace professional medical advice. Always consult with your healthcare provider before making any changes to your medication. Now let's get started. Let's start with a common group of medications: antibiotics. We rely on antibiotics to fight off bacterial infections, and they can be lifesavers. However, some antibiotics, especially when used incorrectly, can put stress on your kidneys. Remember, your kidneys are responsible for filtering your blood, and overuse or misuse of certain antibiotics can sometimes disrupt this delicate process. Now, this doesn't mean you should avoid antibiotics altogether. It's all about finding the right balance and working closely with your doctor. When antibiotics are necessary, they should be used appropriately and for the prescribed duration. Never stop taking antibiotics early without consulting your doctor, even if you start feeling better. And here's a pro tip. Always inform your doctor about any pre-existing kidney conditions or allergies to medications before starting any new antibiotic. By being proactive and communicating openly with your healthcare provider, you can minimize the risk of potential complications. Next up, we have NSAIDs, or non-steroidal anti-inflammatory drugs. Think over-the-counter pain relievers like ibuprofen or naproxen. We often reach for these medications to alleviate headaches, muscle aches, or menstrual cramps. While generally safe for short-term use, long-term or excessive use of NSAIDs can potentially harm your kidneys. How? Well, NSAIDs work by reducing inflammation, but they can also constrict blood vessels in the kidneys, potentially affecting blood flow and filtration. For most healthy individuals, occasional NSAID use is unlikely to cause significant harm. However, if you have underlying kidney issues, it's crucial to exercise caution. Always talk to your doctor before taking NSAIDs, especially if you have a history of kidney disease, high blood pressure, or heart disease. They can help you weigh the benefits and risks and suggest alternative pain management options if needed. Let's talk about diuretics, often prescribed to manage high blood pressure or fluid retention. Diuretics, also known as water pills, work by helping your body flush out excess water and salt through urine. While effective for their intended purposes, diuretics can sometimes lead to dehydration and electrolyte imbalances, which can impact kidney function. The key here is balance. When taking diuretics, it's crucial to stay adequately hydrated by drinking plenty of fluids throughout the day. Your doctor will monitor your kidney function and electrolyte levels through regular blood tests. Be sure to report any unusual symptoms to your doctor, such as excessive thirst, fatigue, dizziness, or muscle cramps. These could be signs of dehydration or electrolyte imbalances that need to be addressed promptly. Moving on to proton pump inhibitors, or PPIs, commonly used to treat heartburn, GERD, and ulcers. PPIs work by reducing the amount of acid produced in your stomach. While generally safe for short-term use, some studies suggest a potential link between long-term PPI use and an increased risk of kidney problems. The exact mechanisms are still being investigated, but it's thought that long-term PPI use might lead to subtle changes in the kidneys over time. If you've been prescribed PPIs for an extended period, it's essential to have an open conversation with your doctor. Discuss the risks and benefits, explore potential alternative treatments, and consider whether long-term PPI use is still necessary for your condition. Your doctor can help you make informed decisions about your health. Finally, let's discuss ACE inhibitors and ARBs, two classes of medications commonly prescribed for high blood pressure and heart failure. These medications work by relaxing blood vessels and improving blood flow, which is beneficial for your heart and overall cardiovascular health. However, in some cases, ACE inhibitors and ARBs can affect kidney function, especially if you already have pre-existing kidney issues. Don't worry, this doesn't mean you can't take these medications if you need them. Your doctor will closely monitor your kidney function through regular blood tests and adjust the dosage or medication if necessary. It's crucial to keep those appointments and report any unusual symptoms promptly. By working together, you and your doctor can effectively manage your condition while minimizing any potential risks. So there you have it. 5 types of everyday medications that might pose a risk to your kidneys if not used carefully.